Hello students, I'm Dr. Tadla and now we discuss anything dentistry. Okay, I've been with you with gynecology as our dear students. Now as online teaching, we will deal with ear, nose, throat and dentistry. So I hope you are doing well at home. So let us start ENTD and dentistry, and we we discuss the summarized topics of ear, nose, throat and dentistry, and mainly we focus on the brief discussion of anatomy and physiology, and we will also see the clinical topics which we see in the detail in the classroom. So the content of the topic include ear, nose, throat, and we call it otolaryngology. So it has anatomy, physiology, evaluation of the patient, his history, physical examination, and investigation. And we will discuss the brief of common diseases or pathologies. So we'll see ear in detail, nose and paranasal sinus, as we call it also rhinology, larynx, we call it laryngology, general otolaryngology, that is head and neck surgery, and head and neck cancer is also discussed in ENTD. Okay, it will be a reading assignment. The other is salivary gland and head and neck trauma. As a dentistry, we will discuss the anatomy of oral cavity, evaluation and examination, disease of hard tissues, and pulp of teeth, gingivitis and periodontal disease. Other is we mainly focus the extraction of teeth and maxillofacial injuries. Will be reading assignment here again. So the educational method as in classroom and as online teaching, it is all about the lectures, and you may have clinical attachment while at 4-year student, and the credit hour is about you. So let us start with anatomy and physiology of ear. Okay, ear is subclassified into 3 different parts of ear as external, middle ear and internal ear, and each has different anatomy and physiologic function. External ear as ear EAC, okay, refers to the external auditory canal, and it is lined with skin or the epithelium and apparatus, skin-lined apparatus, approximately 2 to 2.5 centimeter in length, and it ends at the beginning of middle ear, that is tympanic membrane, and it has different nerves that cross the external ear, usually the commonly cranial nerve 5, 7, 9 and 10, as well as greater auricular nerve. This external auditory canal or external auditory meatus, it has cartilage as well as bone, and it is S-shaped. Okay, this is the picture of external ear or external auditory canal, and it is S-shaped. Okay, up and down, S-shaped. So it has also pinna externally, okay, which directs the outer sound into the middle ear, and here the cut section has, okay, externally tragus, okay, pinna and tragus externally, and this canal we call it external auditory canal. So there are different clinical correlations, so we will discuss in detail in classroom. Okay, So when we come to the middle ear, it begins at tympanic membrane, and the tympanic membrane TM has 3 layers: outer epithelial middle fibrous layer and inner mucosal layer, and it is divided into 4 quadrants, okay? Posterior, inferior, posterior superior, anterior inferior, and anterior inferior and anterior superior. It is divided by long axis of Miles, okay? This is the Miles bone of the middle ear ossicles, or middle, or it is one bone of middle ear, okay? Bones that are 3. So one line crosses this, the Miles, and other line is imaginary perpendicular layer, okay, at ambu. This is ambu. So the middle ear, which begin at tympanic membrane, is narrow cleft connecting external ear to inner ear. It contains the ossicular chains, that is bone chains, okay? Miles, incus, and stapes. Other facial nerve. It has also shunt tube, middle ear muscles, okay? This shunt tube ventilates the middle ear, okay? It balances middle ear and pressure with atmospheric pressure, okay, because it is connected with nasal, okay, cavity here, rhinopharynx, okay. This is shunt tube. It connects middle ear to the rhinopharynx, that is renal, okay, nasopharyngeal canal, and this balances pressure in the middle ear, okay. The other is inner ear, and it contains cochlea, okay, semicircular canals, and this inner ear is responsible for critical functions of balance and hearing, okay. You will see the function of each part of ear that we will discuss: a function of external ear, function of middle ear, and inner ear, okay, part by part. So these are the organs of inner ear, okay, semicircular canal and cochlea, okay. This is cochlear duct, this is semicircular canal. These are the main anatomic parts of the inner ear, and it has, as I have already said, the main function of this inner ear is balancing and hearing, okay, and it is done by the semicircular canal and cochlea. The semicircular canal for balance and cochlea for hearing, okay. So let us see the function of ear, okay, this physiologic function of ear, part by part. External ear, which includes the pinna, okay, pinna, cartilage, and tragus, as well as the external auditory canal. This function is amplification of sound to around 5 decibel, especially at higher frequency, and the other function of external ear is localization of sound source, okay. It localizes the sound, okay, so that we can know from where the sound is coming. The other part of ear is middle ear, and this function is amplification of the sound, that is impedance matching, okay. It is done by the tympanic membrane and the lever action of muscular chains, the bones, okay, the 3 bones of middle ear. So when we see the clinical correlation, atresia or trauma of the pinna will result in difficulty localization of sound source, okay. If somebody, due to different trauma, lose his pinna, okay, he will lose also the localization sound, okay. He can't know from where the sound is coming. The other is tympanic membrane perforation, okay. It brings about hearing loss. The middle ear muscles, okay. Middle ear has muscles, okay, like tensor tympani and stapes. Okay, it has different function and functions by contraction and relaxation. This contraction and relaxation of middle ear muscles, okay, help us to protect cochlea from loud sounds, okay, as it contracts. It impedes or attenuates, okay, the sound about 20 decibels, okay. May not be protective for sudden sound, okay, even though it is protective, has a protective function. For sudden sound it can't, okay, like in gunfire, because of the latency of the sound, okay, coming from the source. Other function of middle ear muscles is provision of the strength and rigidity to the ossicular chains. Other, it is also contributes to blade supply of the chain and reduces physiologic noises like chewing. Okay, chewing is physiologic noise from the teeth, and the middle ear muscles, okay, help in reducing these physiologic noises. The other main function of ear is cochlear physiology, that is hearing physiology. Okay, cochlea is snail shell shaped due to three turns. Okay, has scala media, scala vestibuli, and scala tympani. Okay, the first contain endolymph. This scala media contain endolymph. It is fluid media. Okay, this cochlea is fluid media. Scala media containing endolymph, while the latter two, this scala vestibule and the scala tympani, contain perilymph and communicates at the helicoterema. Okay, when we see the anatomy, okay, this is their communication. Okay, we can't see here it. So the main cells that help us to hear is organ of Corti, which we call it sense organ of the hearing, and it contains the hair cells, outer and inner hair cells. Hair cells transduce sound energy to electrical energy, that is action potential, okay, which action potential produced in hair cells, as you know from neurology, action potential is produced in all or in any manner, and it is transported via the cranial nerve 8, that is cochlear nerve, okay, cochlear nerve or cranial nerve 8. So as we know, the nerve conduction or neurologic conduction is by neurotransmitter chemically or by action chemical, action potential, electrical energy, okay. Loudness is determined by the number of nerve fibers activated. As higher, the louder then the sound, okay, there will be higher production of action potential and activation of more nerve. Intensity of sound weakness by 6 decibel as distance from sound, okay, increases, that is inverse square law, okay. As the source of sound is far, okay, there will be weakness of sound production or propagation of action potential. The other function of inner ear, the second function of inner ear is vestibular function, that is the balancing. It is carried out by semicircular canals, okay, that is anterior, posterior, or lateral cresti, and it is for angular acceleration of head, okay. Other organs that help in balance is otolith organ, okay, macula, article, and saculi for linear acceleration of head, okay, linear motion of head and angular change of head, okay. Balance keeping is done by this. Deflection of mass or head detected by hair cells in the both, okay, in semicircular or otolith organs, and inertia is produced by gelatinous fluid in semicircular canal, okay, semicircular canal, and otocona and otolith organs. So this is all about the anatomy and physiology of ear. Okay, we saw by part. Okay, see you in next topic. Okay, have